All right then, welcome back to Learning Plan 3. We have probably two more sections. Each of these will be about half of the first video. Um, they will cover the next one is going to be covering employment considerations, things to keep in mind when looking for that first nurse's job, and the last section will be about actually transitioning from student to nurse. There is a fairly major transition period, and we need to talk about that. It's important. I hope excuse me. I hope you are surviving the videos so far. I know I am actually having much more fun recording these on video than I did when I just recorded a voiceover on the PowerPoint. Whichever meets your needs better, that's what I'm really hoping you use. I've gotten some good feedback from these videos, and so I'm going to keep doing them. So you get to keep looking at me. So let's just get on with this video. The sooner we start, the sooner we finish. We're talking employment considerations, opportunities, resumes, interviewing, and my guess is all of you have a job, and all of you have a resume, all of you have gone through interviews. Probably most of you have gone through interviews that you've not gotten the job. We're going to talk about strategies for interviewing, but really I'm not going to go into a lot of detail because a lot of this is probably covered in other classes you've had and has been covered by life experiences. But let's just hit some high points. So what are some of the trends in healthcare? Some trends in the job markets. What are we looking at for getting that first job? These are all things we need to keep into consideration. What kind of questions do you think will be asked? And what are your priorities and needs in a job? What are your career goals, long-term and short-term? And now, long-term and short-term in nursing may be different than in other careers. My opinion, just my opinion, you need to know what you want to do for the next 2 to 4 years, maybe 5. I don't know a lot of nurses anymore that are in one nursing position their entire career. There are some. But most nurses get into a job, gain experience, and then move to the right job or a series of right jobs. I've been a nurse for 18 years. I've worked in 2 different hospitals, 2 different insurance companies. I've worked in different departments of each hospital. That's just the way my career path has gone. You need to know what you want to do in your career path. So what is happening in the current job market? Right now, nationally, there is a nursing shortage. Nationally. Locally, it's different. You have to be careful listening to the news saying, there's a shortage of this and a shortage of that, because they're looking at the country as a whole. In the Green Bay area, in the Manitowoc-Sheboygan area, there's enough jobs to keep new hires or new graduates employed, but there isn't a huge shortage. I'm not sure about the Eau Claire, La Crosse area, the Twin Cities area, if you would go that far. My guess is it's similar, that there are enough jobs, but there isn't a screaming shortage like there was in the 80s. Even in the early 90s, there was just a massive shortage, and employers were doing anything to get people in the doors employed. Now, it's more competitive. They want more experience. They want more knowledge. And by more knowledge, I'm not necessarily saying a BSN over associate's degree. If you have a BSN, it will be a plus. No doubt about it. But if you have an associate's degree and good life experiences, that'll work too. In fact, that might work better. Here's the thing, though, you have to keep in mind. The average nurse's age, I believe, is 52 right now in this country. Now, if you look at the average, that means right down the middle is 52. Half of them are younger than 52. half are older. And those older are nearing retirement age. The baby boomers are nearing retirement age. In the next 5 to 10 years, there will be likely massive shortages again. What's the other problem, though, is that the entire population is aging. Older people get sick more. So at the same time the nursing population will shrink, the patient population will expand. So right now, you are getting into the profession at the time where you can get hired, gain experience, and become one of those expert nurses for when the boom really hits. Nice timing. You know, and as an RN, you know that there are just nearly unlimited opportunities for employment. Now, I can't have you raise your hand and tell me what your jobs, what your perfect job is, but most commonly, students want to work in peds, women's health, ED, OR, psych, and sometimes gerontology. Those are the most common areas that that new grads want to work. But don't forget, there is, of course, the traditional med-surg route. There's nursing homes. But there's more than that. Home health, visiting nurses, travel nurses, cardiac, specialty nurses, neuro, school nurses, occupational health nurses, legal nurse consultants. I actually looked at that for a while. A legal nurse consultant is a nurse who works for herself, but it consults lawyers, and they charge by the hour. In this part of Wisconsin, the average rate for a legal nurse consultant is $125 an hour. Not bad work if you can get it. So there are many opportunities. You can become a businessman. You can go into consulting. You can open your, pretty much when you have RN after your name, you can almost write your own ticket to where you want to go. So that's kind of cool about this job. I'm really excited that RNs have so many possibilities. So what area is best for you? And really, look at two things. What do you really love, and what do you really not love? When I was a new grad, I knew that I did not want to work ortho, neuro, peds, or psych. I just wanted nothing to do with them. They just weren't my preferences. I did not get excited about helping people with knee replacements and back surgeries and hip replacements. I didn't really enjoy working with people's strokes. I really did not like working with children. When I was in nursing school, my children were when I graduated, they were 8 and 3. No, 5 and 3, something like that. They were young. And every time I saw a child in that bed, I could only picture my kids, my sons, in that position. I couldn't do it. I just couldn't. I couldn't emotionally distance myself to provide good care without becoming far too emotionally invested. Psych nursing, hated it. Just hated it. I was a cardiac nurse. I mean, when I was a CNA, I worked in the cardiac intensive care, meaning I took care of this part of the body. Loved it. The heart is a pump. The heart is pipes. The heart is fluids. This part of the body. Loved it. You could go in there, you could fix the pump, you could fix the pipes, you could fix the blood. It's a fluid system. Psych, you can't go in there and fix anything. You can only support a person as they fix themselves, and only if they want to fix themselves. Did a psych rotation as a student nurse, just hated it. Let's just leave it at that. So when I graduated, I was not interested in any positions like that. I didn't look. I looked only at cardiac positions. From the cardiac step-down unit, I went to critical care, which was primarily cardiac. My next job in the hospital was in the ER. Now, the ER takes care of everything. We had the ortho, we had the neuro, we had the psych, we had the peds, we had everything. But at that point in my career, I was enjoying all that variety. My likes and dislikes had changed, and yours will too. Do not assume that what you like now is the only thing you'll like, and what you hate now you will forever hate. As you age and gain knowledge in this career, your likes and dislikes will change. So just keep that in mind. Do not lock yourself into a position and forget that you can always look outside where you are right now. What do you like? Do you like working with patients over and over, or do you like rapid come and go? If you like them over and over, you might want to work in a rehab unit or a nursing home, long-term care facility. If you don't like dealing with patients like that, an ER, an OR, critical care is what you're going to want to do. Do you like to work without others as a team, or are you more autonomous? Teamwork, med-surg. Autonomous, ER, ICU. Structured or informal? Do you need supervision to stay on track, or are you independent? What's your physical work setting? Do you like to be on your feet? Do you like to be behind a desk? If you work for an insurance company, you're behind a desk working on a computer. Do you want days, evenings, weekends, 12-hour shifts? Are you good at making quick decisions? Are you good at assessing and deciding like that? That would be an ER, ICU. How about some other things? Are you able to commute? Now, by commute, I'm talking driving more than, say, half hour one way. I know in some parts of the country, a commute could be 2 hours one way, and to me, that would mean I'd probably move. Personally, I'm willing to commute. I live in Green Bay. I teach at Lakeshore Technical College. That's a 45-minute drive. I live about 47, 48, 50 miles. I don't know. It depends on the time of year, on how long it takes me to get to work, but about 45 minutes away, one way. For me, for the right job, I'm willing to drive 45 minutes. That was my limit. When I was at my last insurance company and was eliminated from that position, I decided I want to go to the ER, and I told my wife, 45-minute commute is my limit. That's how I define my geographical area. You might say, I'm only going to stay in this city or this hospital. The tighter the net you set, the fewer chances you have. If you can cast your net far and wide, you have more opportunities. How about the salary range? You don't get a lot of options as a new grad. New grads are going to start at generally a new grad rate and go from there. But every type of facility will have a different starting rate. In general, long-term care pays a little more than acute care, which pays a little more than clinic work. Insurance work actually paid more than long-term care, but there's fewer jobs there. So that's more of a, if you're lucky to grab it, grab it. It's also very different. A lot of nurses like to keep busy and like to do stuff with their hands and just get in there. And insurance work, you're just sitting at a desk, reading papers and making decisions. It's different kind of work. And what are your career goals? As I mentioned, don't just look at short term. I think you should set career goals at the first year, third year, fifth year, 10th year. Look long range. Look at short range, focus on short range, but also keep your idea of long range. What's potentially down the road that you might want to work toward? Those are all the self-assessment ideas that you need to take into consideration in this job, because there are so many opportunities. So what employment opportunities are out there? Generally, you're going to start at an entry-level or staff nurse position in a hospital or long-term care setting. Most often, it'll be in a med-surg unit it'll be a med-surg unit. That's a very good place to get general nursing knowledge. Remember, in nursing school, we're going to teach you how to be safe, how to be effective, and we're going to give you the information to pass your boards so that you meet the minimal competencies for safety, right? When you get your first job, that's when you're going to learn how to be a nurse. You're going to learn more in your first 6 months. You're probably going to learn more in your first month on your first nurse's job that you learned all through school. It's just how it works. So you're going to start in a med-surg unit probably, or a nursing home. But if that's not your goal, if you want to do something else, keep looking for that other job. Get as much experience as possible, but keep focusing on your ultimate goal. What about advanced degrees? You're going to graduate with an associate's degree in nursing, and that's excellent. You're going to be an RN. It's amazing how many people in the community do not realize that the Wisconsin technical colleges put out RNs. They seem to have it in their mind that a technical school, a 2-year degree, is only an LPN. And I spend a lot of time in hospitals, in community, in my neighborhood, talking to neighbors. Yeah, no, technical colleges give you an RN. And an RN, an associate degree RN, and a bachelor's RN are RNs. And will generally get paid the same. A neighbor was asking me, should his daughter go to this private nursing college or should she go to the technical college? I said, well, she's going to be an RN at either place. She's going to get paid the same, roughly. The BSN is preferred, but there's no financial reward for it. However, at a technical college, you're going to pay $10,000 or $12,000 for a degree, and at the college that he was thinking about, it'd be $60,000 or more. Your choice. But I want you to consider working on your bachelor's as soon as you graduate. Because right now, there is no mandatory BSN in this country. I think it's coming. It'll probably go state by state, obviously, because each state sets their own rules on nursing. But I believe that in the not too distant future, a BSN will be a requirement. Now, if they do it the way that they're talking, it'll be crafted as something like a BSN in 10 program, where associate degree nurses can get jobs as RNs, but they have 10 years in which to complete their BSN. That is a long time. I don't want you to take that long. Because hospitals are striving for magnet status. That's the big thing now. And a magnet hospital must have at least 50% BSN or higher to qualify. So if you can go to your interview and say, yes, I have an associate's degree nurse from blah, 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 blah college, and I'm enrolled in a BSN completion program at blah, 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 blah college, that will put you higher on the priority list than a person who just has an associate's degree, because you're proving that you are taking that extra step. Now, why shouldn't you just do a BSN immediately? Most hospitals, everybody has tuition reimbursement. Take advantage of it. Get a job, and then have them finance your BSN. Doesn't that make sense? There's one hospital system, Aurora Hospital, that offers an RN to BSN loan program, where after you exhaust your tuition reimbursement, you can actually get money loaned to you from the Aurora system at no interest, provided you stay there for 2 years working full time. After 2 years, your loan is forgiven. Forgiven. So that's a pretty cool thing. Now the fine print there is, if you accept that loan and then you leave before it's forgiven, you have to write a check for the difference, which is what happened to me. That was a painful check to write, to be totally honest. But a full-time faculty position does not open up very often. I had to grab it. So, yeah. That's a BSN. BSN will open up a couple extra doors. Generally, supervisory roles will require a BSN in hospitals. A BSN will get you some public health positions, occupational health, school nurse usually, things like that will require BSN. But most nurses' jobs are perfectly fulfilled with an associate degree nurse. How about a master's? I have a master's degree in nursing with a nurse educator focus. A master's opens up a few more doors, such as teaching, such as clinical educator in a hospital. Certainly not necessary. And I'll be honest, I don't think my master's has made me a better bedside nurse than I was even before I had my BSN. I think it gives you more high-level view of the position, gives you a better idea of not just providing care to that patient, but an understanding of how your position in that facility affects a broader reach. I don't think it's necessary. I don't think a master's is necessary. In fact, I know it's not necessary to provide good care. But it's a great way to say, I am the professional nurse. Oh, by the way, I also believe that really if nurses want to consider themselves to be a profession, we really should have a 4-year degree as a backbone of our education. That's just my opinion. That will not be on the test. Especially practice areas. You can, with a BSN, you can still get a specialty practice. You can become certified as a wound care nurse, as an OR nurse, as a critical care nurse, as an ER nurse. Those are nice ways of saying, yes, I have a BSN and I'm exceptional in this one area. Those are very nice to work on. You can get a doctoral level of education. You can get a doctor in nursing practice, and that's what will be required to become a nurse practitioner. You can get a PhD. Now, a PhD is usually used in research or education, but you can use it anywhere, obviously. A doctor of, those are the two primary. There used to be a doctor in nursing science, but that's kind of sort of phased out. Doctoral level education is most required in nurse practitioner and to be a professor at a college. I'm not a professor. I'm an instructor. So if you email me, please don't call me Professor Trevor or Professor Lorene. Just call me Trevor. I'm not a professor. I don't want to be a professor. A professor is at a university level. So if that is your goal, if you think that might be long range, go for it. It's great. I think the more education you can get, the more authority you'll be given when you address someone. But if your goal is to provide excellent patient care, you will do that right out of this school that you're in right now. So how are you going to find your job? How did you find your job that you have right now? You can still do newspapers. You can do an online search, which is my preference. Many hospital systems, if you go into that hospital system, you can apply for all the jobs at one spot. To my mind, that's efficient. Aurora hospitals, when you put your application in, when you put your resume in, your letter of application, it stays on file, and it automatically will populate when a position comes up that your qualities meet. You can go to job fairs, open houses. There's not a lot of them out there for nurses. Who do you know, though? That's a big one. Do you know somebody working somewhere? Sometimes when you have that employee contact, that's good. You know, it's the whole old who you know, not what you know. You can do a letter writing campaign. I wouldn't spend a lot of time on it. Telephoning, personal contact. Again, do you know somebody? That's what's going to get you in. My teaching job, to give you an example, to give you a concrete example of how sometimes jobs just appear. I was never intending to be an educator. Never. Ever. My wife's a teacher. God bless her. She's awesome. That was not on my radar. I finished my bachelor's, and I was working in the ER, and student nurses would come down, and they would say, or I would work with them, and this instructor kept saying, we have an opening, why don't you apply? And I think I've already told you this story. She kept, well, I say harassing, but she kept reminding me that to apply, and I'm like, I don't want that job, but finally, okay, fine, I'll apply. And I got the job. Keep your eyes open. Sometimes jobs come knocking at your door, and a lot of times they'll knock only one time. Now this door got knocked on several times. I got very lucky. So, before I applied to LTC, I actually did a little research on the school. I wanted to know about their program. I wanted to know where they were for the first part. I mean, I knew they were south of Manitowoc, but that's it. So I took a drive to see. I just drove out to the campus just to see where they're located. I did some online research on their website. I looked at their program. You can do that for any facility, and I encourage you to. It's in this day and age, if you go to any job interview not knowing about that company, I'll be blunt. You're foolish, lazy, and stupid. I calls them as I sees them. You can research any place. You can find out anybody on the internet right now. There is no reason you should go into a interview not knowing who the chief nursing officer is, not knowing the fundamental background of how they provide nursing care, of where their facilities are. You need to know that stuff because you know what? Your competitors probably know it. If you want that job and you go in and say, yeah, I want to work here, but I don't know anything about your place. I don't even know what color uniforms you wear. Unless you're the only applicant, you're not going to get the job. I wouldn't hire you, to be honest. Now, you may not find what their nursing theory is or what philosophy it provides to their care, but you probably can find some ideas. You will certainly get to know the reputation of the facility and the leadership. So, do your homework. Your homework will not be done when you graduate this school. Do your homework on your potential employers. One thing you might want to look at is how many job openings do they have? And how often are they advertising? A facility, if they're constantly advertising for help, that's a problem. Unless they're expanding, it's a problem. Cover letter. Cover letter is critical. In my mind, a cover letter is more important than a resume. When you send in a resume, either digitally or on paper, and yes, I still mail hard copy resumes in, always include a cover letter. That cover letter introduces who you are. It summarizes briefly your strengths and what you can bring to the position. Keep your cover letters short. 1 page only. 1 page. 3 to 5 paragraphs. Maximum. 5 sentences per paragraph. Maximum. Address that letter to a person, never to whom it may concern. I just told you, you can find the name of the chief nursing officer. She or he may not read the letter, but use that person's name in your dear blah. Okay? First paragraph, hi, I'm applying for a blah, 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 blah position that I saw advertised wherever. I am, and this is where you tell yourself. Second paragraph, I am this, this, and this. Third paragraph, I have done this, this, and this. Fourth paragraph, I look forward to meeting you and discussing this and further. Here's my contact information. Done. 12-point font, proper indentations, proper business format, sign it, mail it. In a cover letter, you do not use the person's educational designations. So if you're writing to a chief nursing officer who has her doctorate in nursing, a DNP, you do not write, dear blah, 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 DNP, just their name. And it's always Mr. or Mrs. last name, never first name. Never address people by first name in a business letter, unless you know the person personally, okay? In which case you probably don't need a cover letter. Cover letter is on 8.5 by 11 inch paper. It's white, off-white, or light blue, no other colors. And by light blue, we mean very light blue. Cream is probably your best color. It's a little darker than white. White is probably the worst of the colors because black ink and white is very stark and bold. Off-white, it kind of makes it softer. I prefer light blue. I'm a guy. Typed, no mistakes, no typos, no misspellings, nothing. No smudges. 1.5 to 2 inch margin on all sides. No abbreviations. Spell out street, spell out hospital, spell out the whole name of everything. Business letter format. That letter will be the first thing your recruiter, your hiring agent will look at. If that's not perfect, you're done. It's pretty simple. You need to catch their attention quickly and concisely on that cover letter. Hi, I am Trevor. Here's what I can do for you because this is what I've done. There, that's it. You don't have to say Trevor though. That would be my letter. In the resume, KISS. Keep it short and simple. Keep it current. You should never have an out of date resume. I don't. I mean, I love my job. I do. I love doing what I do, but I keep my resume up to date all the time. If I get a new responsibility at school, I add it to my resume. If I'm on a new committee, I add it to the resume. I keep it ready because you never really know what's going to happen in the future, do you? So you need to keep yours ready, up to date at all times. Define your strengths concisely. Include your demographic information, your name, address, phone number, email address. Please use a professional sounding email address. There is no reason that you have to have hotlips@hotmail.com. Okay? First name, last name @gmail.com. That is your professional address. Got it? First name, last name @gmail.com. Why? Why don't you want, first initial, last name with a number or whatever? Because you want people to see your name over and over and over. So, first name, last name @gmail.com means they've looked at your cover letter, they've seen your name there. Now they looked at your resume, they saw your name on top in big bold print, and then they saw your name again in your email address. And if they send you an email, they're typing your name in there over and over and over. Have your education, primary. Unless you are an LPN that is currently working, your education should be the first thing after your demographic information. If you're currently working as an LPN, your professional experience will actually be more important than your education. After education, your professional experience. So what if you don't have professional experience? List whatever experience you have that you think will qualify. After that, just list whatever experience you have. Now remember, I think I mentioned, in my opinion, the best nurses are nurses who were formerly salespeople, waiters, waitresses, bartenders. Because they know how to listen to the customer, they know how to make people happy, and they know how to keep their tasks organized. So if you've only worked in a restaurant, that is not a bad thing. One of my former students never was a CNA, never worked in any healthcare capacity at all through school. She worked simply as a waitress and a banquet manager where she planned and organized banquets. Got a job waiting for her before she even graduated, because she was able to demonstrate that she could keep things organized, keep on task, and keep people satisfied at all times. So don't worry about it. If you don't have a wonderful, huge healthcare resume, that's okay. It's not necessary. If you have any other licenses, if you're a licensed paramedic, make sure that's in there. If you belong to any professional organizations, your local student nursing organization, or any professional type organization, make sure that's listed. Do you have any honors from school? Did you graduate with honors? Did you receive an honor from a local Chamber of Commerce or Rotary or anything like that? List that in there. References do not get included on your resume. You do not even have to say references upon request. That is assumed. Do not include references with your resume. If they want references, they'll ask. Did you notice one thing that's not listed there? What's not listed in that list of resume components? Professional objective. That used to be very important. It's not anymore. In everything I've done research for career promotional career advancement, professional objective should never be on your resume. Why? That's what your cover letter is for. Don't waste space. Don't waste real estate on your resume with something that should go on your cover letter. And you want to be a nurse. You want to be a nurse in a med-surg organization. Do you really have to add that on a resume? No. You've said that in your cover letter. Hi, I am Mary Smith. I graduated from thus and such college, and my goal is to be the best med-surg nurse that you have because you're advertising that position, or however you're going to phrase it. Okay? That way your resume is more generic and quickly applicable to every position that that opens up. Okay? There you go. So that's your resume. Ideally, a resume should be one page, and probably all of you will have one-page resumes. Now, I have a two-page resume, but I have many different professional designations. I have a lot of experiences. Two-page resume, it's fine. If you start becoming very active in academia and are writing articles and getting published, you may end up with a 3, 4, 5-page resume. Those are called CVs, or curriculum vitae. Okay, a CV is more for education. I don't have a CV. I'm not published anywhere, and I don't plan on it, actually. But initially, 1 page, 2-page max. But as with almost everything in life, exceptions do abound. But your cover letter, 1 page only. How can you submit a resume? Well, you can carry it in. You can email it, which is probably the most common. You can upload it electronically, which is another very common way. You can mail it. My recommendation is to follow whatever method your facility wants. But when you go to that interview, I always bring 3 or 4 copies with me, because you never know how many people are going to interview you, and you also don't know how it's going to print off. I have seen emails digitally submitted that when they print it off, the formatting is just atrocious. So I bring in a couple nice copies that I can hand to people. It costs you the paper and the printer ink. It's worth it. Now, what about the interview? You've all been interviewed in jobs, I'm certain, but I'm just going to give you a few ideas. Has anybody ever practiced their interview? I did. For the job I have right now, I've never been interviewed for a school before. So I came up with like about 20 or 25 potential questions that I thought I was going to get asked, that I thought would apply to an educational career. And I practiced giving answers to those questions. I got asked a few of those questions. Certainly not all of them. But I had a good idea for all the questions that I was asked. So write out all potential questions. Practice your answers. Practice talking to a mirror so you know what you look like when you're giving answers. It's amazing what hand gestures and facial expressions and all that stuff that I'm doing to you in this video. It's amazing what people do without realizing it. So do you talk with your hands a lot? Learn to keep them in your lap maybe and use them just to accent things. Or do you sit on your hands and never move them? Learn to use them as accents. Come up with 1 or 2 questions that you can ask at the end of the interview. Please ask questions, even if you don't really need to ask any questions because you've done a great job of researching the facilities. Ask a question. If you say that, because every interview will end with, do you have any questions for us? If you say no, that means either you think you know it all already or you don't really care. What do you think those two inferences imply? So make sure you have a couple questions. And do not say how much does it pay. That's the wrong question. You knew that. Ask for things such as, what's the projected start date? Could I have a tour of the unit? That's a good one. Is there a time that I could come back and shadow someone on the unit? What is your educational plan, or what is your requirement for education? Come up with some questions that are not about benefits, but that imply that you really want to know more. Don't be late to the interview. Be early, but not too early. 5 to 15 minutes maximum. If you arrive more than 15 minutes early, you look a little desperate and maybe you weren't organized enough. If you arrive late, that's just bad. So 5 to 15 minutes early, be dressed appropriately, and bring a portfolio with your copies of resumes in it. Maybe bring a copy of your license, copy of your BLS card. Anything that you think might be needed to support your candidacy. Look the part. Okay? Dress professionally. Show up, again, first 5 to 15 minutes early. Shake hands firmly. None of this wimpy handshake. Even if you are a young lady and she is a lady interviewing you, don't give a wimpy handshake. You don't have to crush the hand, but show that you're there, you are solid, you're real. Make sure you understand your body language and what body language means. Make eye contact, but don't stare at the person. Okay? It's okay to look off as though you're thinking of something, but then bring the focus back to that person. Use hand gestures appropriately. Smile. Ask if you can take notes. Because unless you have a perfect memory, you're going to learn information. And if your memory isn't all that, you're going to forget things. But smile. Always smile. Look the part, dress appropriately. Minimal jewelry. Minimal perfume or no perfume. Even if where you're going is business casual, dress in proper business attire. So, a suit or a dress for the women, a suit for the guys, or at least dress pants and a jacket and a tie. Even if you're working for a place that is nothing but scrubs. Remember first impressions? They really do count. Do little things. Breath mint before you enter the building. Make sure every possible component of you is positive. In general, and I've done hiring before, in general, hiring is not necessarily, the interview process is not to look for the best person, it's to get rid of the worst people. That's the first interview. Because most places will have 2 interviews. The first interview is to weed out everybody bad. And the weeding process is brutal. It's like if your shoes are scuffed, apparently you're you don't pay attention to details. If you're chewing gum and popping gum while you're talking, gone. So be prepared, look professional. Try to remain calm when you're being interviewed. I know it's stressful. It really is. But try to be as calm as possible. Ask for clarifications. If you've been asked a question and you're not really sure what they're asking for, ask them to clarify or give an example of what they mean. While they're doing that, use that time to start thinking of your answer. Ask for time to answer a question. You will get asked some tough questions. It is very appropriate to say, can I take a moment to think about that? That's better than just blundering in with any old answer. If you get asked a question and you just don't know, you can always say, can we come back to that? That's fine. Again, it actually shows more professionalism than just giving a random answer. It shows that you have an attention to detail and you are focused on providing the best possible information. That was my son texting me. Ask for a business card. That's a great way of showing that who you were talking to is important, and it gives you a name and you know how to spell it. And if you want to send a thank you card, now you know exactly where to send that thank you card. It's just some things of what not to do. Excuse me, and I would imagine none of these really need to be mentioned, but I'm going to anyway because I have the information and I may as well use it. No wild nail polish. This goes for men and women. I have known guys who put polish on their nails. That's fine. I don't care. But your employer might. So look neat and clean. No jangling jewelry. That's everywhere. Just nice and subdued. No open-toed or backless shoes. No out-of-date suits. This will be for guys. More guys than women. 'Cause most women I know keep very up to date. Us guys, we sometimes don't. So make sure that everything is looking good. No short skirts, okay? No leather jackets, turtlenecks on men. Wear a tie. This is an important event. So put a dress shirt on, put a tie on. Keep your handbags and suitcases conservative. No red briefcases. Believe it or not, that is out there, and it just sends the wrong signal. Conservative. Shades of gray, blue, those are best. Wearing black to an interview is usually considered too serious. If you are going to wear a black suit or black dress or whatever, make sure there's another color near your face to soften it up. But again, just avoiding black is going to be best. So I'm just kind of going ahead and make sure I have everything covered here. You can always ask about benefits, or if they mention benefits, then by all means go ahead and get more details. Frequently, it's not uncommon to be interviewed by an HR person where they will talk about benefits and then get all the information. But if they don't bring it up first, you shouldn't either. You may get offered the job, you may not. Be prepared for a no. More people will get no than yes. Avoid being pressured to say yes. If somebody calls you up and says, we have an offer, but we need to know your answer right now, that's a red flag. There's a problem. And if I were told that, I personally would say no. Because I don't know why they need me so immediately. You can always decline their offer. If they offer you a position and it's the wrong shift or wrong location or wrong pay, just say, no, I'm sorry, that offer does not meet my needs. And say it like that. That offer does not meet my needs. If they want you, their next question will be, well, what can we do? Don't say, no, I need more money. Or, well, I was offered X dollars more somewhere else. Just say, I'm sorry, I need to decline this offer because it does not meet my needs. and then that puts the ball in their court. If you were rejected, here's a good question. See if you can find out why. Just ask them. I understand that I didn't meet your qualifications. Exactly what could I have done differently, or what could I bring to the next interview to strengthen my position? You might get some very important information. You can always follow up with a thank you letter. Always appropriate. Now, if you don't like the job, what about that? I mean, how long do you have to stay in a job before you can look for something else? I would say it doesn't matter. Seriously. If you're not happy in your job, I would say, okay, here's an opinion. If you're offered a position, especially full-time, take it. Regardless of where it is, take it. Full-time positions are not always easy to find. If it's not the perfect position, take it and keep looking. Yes, that might mean a month later you'll quit and take the perfect job. You tell the second employer, they'll say, why are you looking for a job? You've only been there for a month. You can always say the honest truth. I took that job because I needed a full-time position. But this is the job I really want. That's honest. We all understand that paychecks are really important, and a full-time position is great. Sometimes you take things that you don't really want because it covers the necessities. Keep looking, though. When I was working in the ER, the second I started, my first day on the job, the second day I needed to take off because I had a job interview somewhere else. I had made that appointment for the interview before I started working. I took it. I did the interview. It turns out the interview was horrible, and I didn't even want the job, but I didn't know that at the time. Keep looking. Always give 2 weeks notice if you can. Keep a positive outlook. Don't slam the person that you're leaving, saying, I took this job just because I needed the money. They probably know that. You don't have to say it. It's always nice to write a nice letter of resignation. You don't have to go into extensive detail. Just say, I regret to inform you that I'm leaving effective whatever day because I've been offered a position at such and such a place. And that's really all you need to say. All right, well, that ends this part this is the second part of Learning Plan 3 interview. Come back for the third part. It's exciting. It's about transitions in nursing. It's a blast. Or something like that. See you in a little bit. Bye.